class in health. This is the first live streaming since the third quarter has started. Welcome to Valenzuela Live. Today, we will discuss health trends, issues, and concerns in the global level. But before we start our lesson for today, I would like to remind you with the following as we go along with our online class. Students, here are some reminders during our online discussions. Number 1, be on time. Make sure that you log in on your account and follow the given schedule of our discussion. Number 2, sit comfortably. Refrain from lying around. Instead, sit comfortably and properly. Number 3, avoid unnecessary comments on the chat box. Refrain from sending unrelated sticker comments in our comment section. Number 4, stay focused and avoid interruptions. Find a quiet and comfortable place to listen to the lesson. Number 5, take down notes while listening or watching. Make sure that you have your pen and paper with you throughout our discussion. And number 6, extend help to your classmates. Let us all learn together and enjoy the rest of our discussion. Here are the most essential learning competencies for today. Number 1, discusses the significance of global health initiatives. And number 2, describes how global health initiatives positively impact people's health in various countries. For its central role in global affairs, health issues are among the priority concerns of the United Nations. It thus designated the World Health Organization to serve as the lead agency tasked to direct and coordinate with all member nations regarding leadership, supervision, technical support, and education on matters about health, which affects many countries, including Philippines. But before we proceed to our lesson, let us have a short activity. Look for 10 global health issues and concerns that the World Health Organization and member nations are facing. You are given 30 seconds to key in your answers. Timer starts now. Time's up. Let us now find out the answers. We have malaria, water safety, diseases, women's health, mental health, HIV, environment, nutrition, tobacco, and COVID virus. Did you got it all correct? Great job. All right. Thank you, students, for participating. In the 21st century, public health protection is viewed both as a shared duty and obligation. Thus, people need to understand global issues, concerns, and trends that include fair access to essential healthcare and protection against multinational threats which directly or indirectly affect the health and lives of billions of people worldwide. The United Nations Millennium Development Goals are 8 targets that all 191 UN member states have agreed to achieve by 2015. The United Nations Millennium Declaration, signed in September 2000, commits world leaders to fight discrimination against women and children, diseases, hunger, poverty, illiteracy, and environmental degradation. All these goals cannot be attained without addressing each and every one. All of them influence, affect, and depend on better global health programs and policies. The first one is eradicate extreme poverty and hunger. Developing countries, particularly in Africa and Asia, suffer from the extreme poverty and hunger. Poverty and hunger leads to severe malnutrition, which leads to lifelong physical and cognitive damage and effects of health, well-being, and the economy. Now, these are the objectives to achieve this goal. First is through education. Number two, promote gender equality. Number three, producing more jobs. Number four, investing more in agriculture. Number five, strengthen nutrition programs for children and infants. And number six, support and protection of developing and vulnerable countries during crisis. The next one is achieve universal primary education. Persons, particularly women, are educated, are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have better survival rates, are healthier, and better nourished. To achieve this goal, these are the objectives. Number one, marry and have their own families at later stage in life. Number two, practice family planning and have fewer children. Number three, know rights, responsibilities, and civic obligations. Number four, seek employment and sustain personal and family needs. Number five, have decreased risk of getting sexually transmitted infections like HIV/AIDS. And number six, support and protection of developing and vulnerable countries during crisis. Let us now have our third Millennium Development Goals. It's promote gender equality and empower women. Gender equality means equal representation of men and women. It implies that all gender should have equal value and treatment. Equal gender treatment empowers women in other groups, creating opportunities in education, work, finances, and other aspects, which improves the economy and lessen effects of financial crisis. Let us now have the objectives to achieve this goal. First is early childhood development intervention. Second, promotion of women's political rights and involvement. Third, improve reproductive health programs and policies. Fourth, education and integrating gender equality in school curriculum. Fifth, improved women's access to work and strengthen labor policies for women. And number six, support and protection of developing and vulnerable countries during crisis. Let us now have our fourth Millennium Development Goal, reduce child mortality. Programs and policies which help reduce child mortality, like improving nutritional intake, healthcare facilities and infrastructure, and other fields which improve children's lives. Strengthening local and national health programs and policies is one way to reduce child mortality. Now, these are the objectives to achieve this goal. First, immunization programs. Second, assuring the survival and better health of the mothers. Third, improving reproductive health programs and policies. Fourth, better nutrition programs for infants, children, and mothers. Fifth Millennium Development Goal, improve maternal health. Improved maternal health is not only about mother's health, but also involve the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender inequality, decreased workforce, lower birth deaths, and disability of women. Now, these are the objectives to achieve this goal. Number one, improve and proper nutrition of mothers. Number two, teaching the benefits of birth spacing and small family size. Number three, educating young boys and girls about the importance of maternal health. Number four, better and improve access to hospital care, especially obstetrics, gynecology, prenatal, and postnatal care. Let us now have the sixth Millennium Development Goal: combat HIV/AIDS, malaria, and other diseases. Emerging and re-emerging diseases like HIV/AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the effects of diseases outbreak are loss of jobs, shortage in professional workers, and creating social crisis. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal growth and development. These are the objectives to achieve this goal: improve housing conditions. Number two, increased access to anti-malarial medicines. Number three, promoting safer sex behavior and preventive education for all. Number four, promoting tuberculosis screening of HIV/AIDS persons and TB dots or directly observed treatment short course therapy. And promoting the use of insecticide-treated nets to fight mosquito-borne diseases. Let us now have our seventh Millennium Development Goal, which is ensure environmental sustainability. Investing in supporting sustainable energy like solar, wind, and water energy helps support jobs. It also creates business opportunities and save remaining non-renewable energy sources. Environmental sustainability assures people to live healthier and enjoy a clean and green environment. Now, these are the objectives to achieve this law. First, it's a cleaner air environment. Next, clean, environmental friendly, and renewable energy. Next, we have the new and aspiring jobs in business and energy, and increase access to sanitation. And last but definitely not least, Global Partnership for Development. The United Nations, World Health Organization, World Bank, and government work together to make sure there is a fair trade and that heavily in debt countries obtain relief and funds to combat poverty, malnutrition, and funds for education and social projects. Now, these are the objectives to achieve this goal. First is expanded international trade agreements. Second, improved access to affordable medicine. Third, reduce poverty through government debt relief grant. Fourth, develop information and communication technology infrastructure. Now, we have achieved some of these goals last 2015. That is why the United Nations decided to continue this project until today. This is now called a Sustainable Development Goal, which will be discussed in the second part of this lesson. Another project that would address the problems in global level is the Global Health Initiatives. One of the benefits of globalization of the world is the development and improvement of various health initiatives initiated by different nations and governments to address health issues and concerns. Global health initiatives are programs set in motion by the United Nations through the World Health Organization and in partnership with the World Bank, which targets specific health problems, including but not limited to emerging and re-emerging diseases, climate change, environmental sanitation, mental health, tobacco regulation, and alcohol use. Now, these are some examples of global health initiatives. First, let's have Roll Back Malaria. Roll Back Malaria is a global health effort to reduce the number of deaths from malaria infection through high-end prevention tools. rapid response to outbreaks, development of anti-malarial products, and effective treatment of the infection. Now, these are the objectives. Number one, to enable and to increase the capacity of caregivers to recognize malaria promptly and take early action appropriately. Number two, to empower service providers by imparting adequate knowledge, skill, and capacity, which enable them to respond to malaria illness appropriately. Number three, to create an enabling environment for implementation. Let's have our second health initiative. It is Stop TB. Stop TB is a global effort to prevent further transmission of tuberculosis around the world. One of the programs for Stop TB is the implementation of the TB Dots short strategy. Let us now have the objectives to achieve this global health initiative. First, to achieve universal access to high-quality diagnosis and patient-centered treatment. Second, to reduce the suffering and socioeconomic burden associated with TB. Third, to protect poor and vulnerable populations from TB, TB-HIV, and multi-drug resistance or TB-MDR-TB. And fourth, to support development of new tools and enable their timely and effective use. Third global health initiative is the Global Alliance for Vaccines and Immunizations. The Global Alliance for Vaccines and Immunizations is a global strategy which aims to strengthen children's immunization programs and introduce new generations of licensed vaccines into use in developing countries across the globe. These new vaccines could help reduce the number of deaths in children aged 5 years old and below. Let us now have the examples of vaccines to be given to the children. First is the hepatitis B vaccine. Second, childhood meningitis vaccine. Third, yellow fever vaccine. Fourth, influenza vaccine. And fifth, vaccine for pneumonia. Let's have another global health initiative, the Global Fund to Fight AIDS, TB, and Malaria. The Global Fund to Fight AIDS, TB, and Malaria is a funding project rather than an initiative. Nevertheless, it helps in the prevention, reduction, and mitigation of the negative impacts of these three diseases to humanity, which contributes to the fulfillment of the Millennium Development Goals. Next is a global strategy to reduce and control the harmful use of alcohol and tobacco. The World Health Organization Framework Convention on Tobacco Control is the prime international treaty negotiated under the World Health Organization. The WHO FCTC came into existence in reaction to the global epidemic of tobacco use and abuse. It reaffirms the right of every individual across the world to the highest standard of health, promoting public health and providing a new legal means for global health cooperation. The following summarizes the WHO FCTC provisions. Number one, price and tax measures to reduce the demand for tobacco. And number two, non-price measures to reduce the demand for tobacco, namely protection from exposure to tobacco smoke, Regulation of the contents of tobacco products. Regulation of tobacco product disclosures. New packaging and labeling of tobacco products. Education, communication, training and public awareness. Demand reduction measures concerning tobacco dependence and cessation. And tobacco advertising, promotion, and sponsorship. Another global health initiative is Global Strategy for the Prevention and Control of Non-Communicable Diseases. The Global Strategy for the Prevention and Control of Non-Communicable Diseases is a global action plan to prevent and control the following non-communicable diseases: cardiovascular diseases, chronic respiratory diseases, cancers, and diabetes. And the four risk factors are unhealthy eating, physical inactivity, tobacco use, and alcohol use. Let us now proceed to another global health initiative. It is a global health initiative for mental health. Comprehensive Mental Health Action Plan from 2013 to 2020. The Comprehensive Mental Action Plan from 2013 to 2020 is the result of extensive research and consultations of stakeholders, member nations, academics, and non-government centers across the globe. The Mental Health Action Plan should be impartial, life-based, and preventive in nature. Before we end our discussion for today, let us have an assessment. Key in your answer in our comment section. Are you ready? Let's have number 1. Which of the following is the focus of Global Health Initiative? Letter A, target all global issues and concerns. Letter B, target all health issues. Letter C, target specific health problem. Or letter D, target specific health solution. Number 2, one of the Global Health Initiative's significance is the effort to prevent the transmission of tuberculosis around the world. What program was implemented by the WHO to stop TB? A, global vaccines and immunizations. B, rollback TB. C, TB dots short course strategy. Or D, TB dots vaccination. Number 3, the Global Health Initiative aims to strengthen the children's immunization programs and introduce the new generation of licensed vaccines. Which of the following vaccine is not included in the program? Letter A, childhood meningitis vaccine. Letter B, hepatitis B vaccine. Letter C, HIV and AIDS vaccine. And letter D, influenza vaccine. Number 4, environmental sustainability assures people to live healthier with a clean and green society. What do you think is the best global health initiative you must do to ensure environmental sustainability? Letter A, combat poverty. Letter B, education. Letter C, improves housing project. Or letter D, support solar energy. Number 5, improve maternal health is not only about mother safety, but family wellness and positive assurance of mother's health. Which of the following is not a way to improve maternal health? Letter A, word spacing. Letter B, gender equality. Letter C, prenatal care. And letter D, proper nutrition. All right, students, here are the correct answers. Three and go. Great job. That's all for today, class. I hope that you had fun while we are discussing health trends, issues, and concerns in the global level. For now, I would like to end our discussion for today by reminding everyone to keep calm and always remember, prevention is better than cure. I hope everyone to be safe and healthy. Goodbye, class, and see you next time.